Hello, I'm Dr. Neil Renaud, optometrist at Eagle Eye Performance Vision, where we specialize in vision therapy, and today's video is all about traumatic brain injury and how that can affect your vision. Before we start, make sure to hit subscribe, check us out on Facebook and Instagram as we keep posting content and help making vision therapy more visible. Here's a crazy fact: 90% of all traumatic brain injuries have some kind of visual deficit or dysfunction. And just in terms of concussions, vision is one of 6 main subtypes of problems that can happen after a concussion. We can see vision problems, we can see vestibular problems where a patient, their inner ears are struggling to work together and causing a lot of nausea, dizziness, motion sickness. We also can have cervical issues in the neck, so whiplash or just neck pain, a lot of tightness. Migraines and headaches can be very severe. We can have emotional problems like anxiety, depression, lots of irritability and fatigue, as well as cognitive challenges too. So just not quite thinking and processing the same way you used to, struggling to find the right word to say, or remembering things, or thinking quickly on your feet. All of those can be major problems related to a brain injury. So traumatic brain injury can happen from any type of injury to the brain, and that can be contact or non-contact actually. So they can happen in sports, football, basketball, soccer, any type of sport where there's head trauma. We also can see them in vehicle accidents, in a car, if you are riding a bike and fall off your bike. We even see people in mobile situations, not in a vehicle, like slipping in ice in Michigan in the winter, as well as a lot of workplace injuries as well, where something hits your head and there can be all kinds of reactions to that. And even though it's still not very well understood exactly how a concussion happens, what research indicates is that as the brain is kind of jostling around with that head trauma and impact, there are axons that are stretching and shearing actually in the brain. That's where the injury can happen. And because vision has such a huge role in the brain, it's really in every lobe all over the brain, there's a visual role. That's why we can see so many visual problems after a brain injury, no matter the type of injury. Vision should be a very effortless and seamless process. We should not really think about how to move our eyes. We should be able to do it without trying. After a brain injury, pathways that developed normally during our life have been disrupted and damaged, to where now something that used to be very easy and effortless now takes a lot of effort. It takes a lot of attention. It takes a lot of cognitive effort to do something that used to be very simple. You weren't even thinking about it, like reading or walking through a doorway and not bumping yourself, or riding in the car without feeling sick. Within a month, most concussions heal. About 10% of the time are very unlucky people who go into Post Concussion Syndrome, where they still have concussive symptoms long after the injury happens. So the type of vision symptoms that we deal with in our practice in the patients who've had traumatic brain injuries and concussions really fall into 3 categories. They can have trouble with their reading and near-point visual skills like computers and books. They can struggle with motion problems, and they can also struggle with sensitivity and filter issues with their vision. So in reading, we need to turn our eyes inward, flex muscles to get turned in, zoom in and focus on the page. If we're struggling with that, the patient could see double, they could see blurry while reading. We also need to make accurate movements across the page, which can become very inaccurate in a concussion or brain injury. And then we need to process our vision very rapidly and efficiently. With a motion type of symptom, we can see patients who are very dizzy, nauseous. Anytime they're moving, they're very uncomfortable. In the car, they get car sick. They struggle to move basically and want to be sitting with all of their environment very still as well. The sensitivity type of issues we see in vision are visual motion sensitivity and light sensitivity. So someone can be very, very sensitive to indoor fluorescent lighting or outdoor sunlight. They could struggle with visual motion sensitivity. So think of, like at the grocery store, how much movement and motion we see in our peripheral vision. Someone after a brain injury can really struggle with those kind of places and get anxious or dizzy or severe headaches, all kinds of problems. And then we also can struggle with a visual filter. As you're watching this video, you are looking at your phone or your computer. You're probably not paying much attention to that chair in your peripheral vision or the light above you. Our brain is very good at filtering and paying attention to what's important, ignoring what's not important. Someone with a concussion, they can struggle with their filter and their visual skills, so they can be very fixated on things that are not important and struggle to maintain visual attention on what they are trying to concentrate on. So how do we help these people who are struggling with their reading, with their motion processing, with their visual filters and light sensitivity and all those different symptoms? Really, the goal is to get you feeling better as quick as possible and as fully as possible. We want to see full recovery or as close as possible to that and speed up the process. Because if you're missing work right now, if you can't ride in a car, if it's your senior year of football and you want to get back on the field, then we want to see things happen fast. We don't want to be in this recovery process for a year when it could take 6 months or we could make things shorter, and we could make that recovery process more complete and get you as close to normal as possible after the injury. So in rehabilitating a brain injury, we don't know if there's any permanent damage or if the patient can make a full recovery. Think of like if you're driving and the main road that you like to take has construction and you can't take that route. Well, after a brain injury, we've lost the main pathway, plus now you are also taking every dirt, gravel road, and indirect route that you can. Our brain used to process so effortlessly and seamlessly, and now we are struggling to do something as simple as reading or sitting in a car. We are using the most inefficient pathways possible, really, and the goal in our treatment is to get you back to onto the main road, doing things the easiest way possible, or if that pathway is too damaged, we can also potentially find a new route that is better than what you're working with right now. So the first step in our treatment process is to do a very thorough, comprehensive vision exam and look at all of the visual skills related to your symptoms. This is different from a routine eye exam. We're going way beyond just can you see 20/20, because actually most concussion patients and brain injury patients, they can still see 20/20. It's just everything around that where they struggle with. So we look at how your eyes work together as a team. Why are you getting double vision? Why are you seeing such blurry vision when you're reading? Why does it give you so much eye strain to get your eyes focused up close? We look at that visual motion sensitivity. How's your peripheral vision? How do you process light and different motion in your vision? And then once we have a full and complete understanding of what's going on and what's wrong, what your eyes are doing fine and where they are struggling now, then we look at treatment approaches with vision therapy and therapeutic lenses. Therapeutic lenses are part of vision therapy, but think of them almost like crutches for your eyes. They are addressing an injury. They get you more functional right away so that maybe now you can go to work. Maybe you can tolerate a computer for a few hours a day. You can drive again. You can go to the grocery store. You are more functional with those therapeutic lenses on that help compensate for an injury that you're dealing with that's debilitating your lifestyle. We also in vision therapy work on activities in the office where we work one-on-one with a vision therapist to rehabilitate and retrain the brain on how to use those eyes the way that you did prior to your injury. And then over time, as you recover, then we can start to taper off and try to discontinue those therapeutic lenses as much as possible to where you were before the injury, where you didn't really need them. Plus, we suggest a lot of lifestyle modifications. Here I'm talking about symptom management, strategies to calm down a flare-up of symptoms or how to avoid them, diet, hydration, sleep cycles, lots of different ways that we can try to speed up recovery and make you feel better in the meantime. Then as you progress through our treatment and you're rehabilitating your visual skills, I monitor how you're doing through repeat testing, see that your test scores are increasing, and looking at your symptoms and making sure that those symptoms are improving and resolving. So if you are dealing with a concussion, if you know someone who's struggling with some kind of traumatic brain injury, I encourage you to reach out to us at eagleeyevisiontherapy.com to learn more. Give our office a phone call at 616-848-7548 to start a conversation with a free phone consultation. And if you're even outside of our area in the West Michigan area, then check out covd.org. Find a doctor in your area that specializes in vision therapy, and they can look into if they can treat concussions and try to help you. So thank you so much for watching and learning more about traumatic brain injury and how it can affect vision. And stay tuned for more vision therapy related content and videos.